Just give me a glass when you get a chance. It's not urgent. Hi everybody, Dr. Qazi here. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing and collagen stimulation as well. I'm going to go through this patient. He's a patient that I've worked on a couple years ago. He's got great results, great improvement right now. He's going to continuously get better results. I haven't seen him in about a year, but he said it's gotten even better right now. Sometimes he comes on this live actually too. And I'll walk you through just what I did for him and explain just what we could do for patients when they have acne scars. There's a lot of steps that are involved really even just to get to this part, but I think we'll continuously get better and better improvement over time, especially if we do more volume. What I mean by that is that he has a little bit of fat destruction, some fat loss, and if we improve that, it's going to be a better and better result here for him. So I personally love this result. He's a great, great patient. And I had a few patients who were asking about something with rolling scars too. So I'll show you that right now as well. So if you could take a look and see, this is a patient right here with rolling scars, deep, deep scars. I'll show it to you on the screen in just a moment here as well. And you can see for this patient, really, she had very significant fat loss, and that's really classic when it comes to rolling scars. Hi, Mara, good seeing you on. I haven't seen you in a little while. How's everything been for you? Okay. I think my time change has probably been something where maybe a few people I haven't seen come on for a bit now. But thanks so much. Thanks so much for joining us. How are you doing, Amber? Hopefully you've been doing really well too as well. Sorry, I got a little bit late. I was working up until now. And I was going through this case right over here. This is a patient with deep, deep rolling scars. And we're going to go through just exactly how I solved that and what we need to do for her scars. I'll showcase that just a bit for everybody, and you'll be able to see just an incredible improvement of her texture. Right now, I'm also showcasing a gentleman who I worked on a few years ago too. And that particular patient, he's somebody I see once a year or so. Really, really excellent improvements at this point, but he's going to get even better improvements. He said, I talked to him recently, he comes on the live every once in a while, and he said that at this point it's even better, the scars are even looking better right now. So that's really cool. That's a really, really cool feeling actually, that we're already seeing more and more improvement right over here for this patient's scars. What do you think of ablative ultra clear laser? What's downtime? So with ultra clear, it's fractional ablative. So what that means is basically that it essentially is a bit of a gap with it. So some of it will be intact skin, some of it will be destroyed skin to remodel and trigger more collagen production. But you definitely could do a fully ablative form of it as well, where you drill down with the smaller handpiece. That's something you could do with almost any laser or energy device. So it's not necessary that you have to have something where it's particularly with ultra clear per se. Really almost any laser can do this when you have the surgical handpiece. There's not many people who do the surgical handpiece when it comes to scars. I think, I mean, there's very few. I'm not sure if there's other people out there. I don't know, I don't personally know of too many, maybe a handful of people, if that. I know that it is getting like where people are talking about that more often now and doing it now, and I'm getting a lot of physicians who requested and asked me about it, but it's not necessarily the way a lot of people do. So when they say ablative handpiece, they really mean a lot of times what they mean is they mean fractional ablative. And that's fine. I mean, there's nothing wrong with fractional ablative for a lot of patients. You know, for example, this patient, some of it we do is with fractional ablative. But sometimes what we also end up doing is with fully ablative. So that means that we did something where we burned down the edges of the scar and I cut it out, actually, that scar tissue. So that's really helpful for patients when there's excess scar tissue. We want to actually just sand that down. It's just that there's, of course, more involved with that. We have to be very, very careful as we do it, and very meticulous. And that's exactly what I like to do. I like to make sure that we're very careful and we're just constantly chipping away that scar tissue. There's definitely a way of doing it. It works out incredibly well. It's just that I say that many people are afraid of doing it that way because they're worried that if they do it, there's going to be loss of pigmentation or excess pigmentation. And I think that's a very reasonable concern. You have to have a very good patient selection when you do it. There's another way of doing it too, which is where you don't necessarily have to go as intense as potentially other people recommend. You sometimes just like slowly chip away at it. And what I mean by that is just like I do little bits at a time, and just like very low energy, and just keep on doing it. Works out very well for the right patient. There's some people though that really do need just like stronger. It's really, especially if you need a lot more collagen production. It may end up needing to be where you have to go with a fully ablative CO2 laser, pretty aggressive with that, and that may be necessary for certain patients. But it's in general the case where I go pretty light and just kind of keep on chipping away at that scar tissue. What are your thoughts on Winlevi for acne? I think it's okay. I think that spironolactone is one of the better options, though, to be honest with you, for acne. It's also cheap. It's also really cheap. It's only like $8, and like there's almost nothing that's just like $8 when it comes down to it, you know. So it's $8, so it's like pretty cheap usually on with coupons. So that's pretty good. Winlevi is like usually even with insurance, it's like $100 something a lot of times. So yeah, I think that spironolactone just for cost purposes is really good, but I understand that some people just don't want to take pills or can't take pills. There's actually some people who just physically just can't take a pill. It's really tough for them to do that. I've encountered them many times. I think that though we have to be really careful though, because if there's an issue where there's something that's cheaper and potentially even better, it's at least worth talking to patients though about that. At least worth saying, maybe let's talk about how do we get this so you could do this more regularly. A lot of times you have to do it twice a day, but that's okay. I mean, if you could do it twice a day, it could work out incredibly well. The problem again is that compliance is an issue. Winlevi is just, in my experience, not as great as spironolactone, and spironolactone is cheaper. So that should kind of tell us something, that a cheaper medication which works very well, probably better than Winlevi, it's accessible to patients. It's just the problem is that it's an oral medication, and so people say, well, I don't like taking pills. Which I understand, like nobody wants to take it, but that's the only challenge though, is getting people to convince to do it. Oh, hi Masood, how's it going? Good seeing you on. I was showcasing your result earlier actually. Good to see you. Hopefully you've been doing really well in life. Hello doctor, what do you push under the skin before doing subcision? That's actually a bunch of lidocaine right there. That's what that is, and it works out very well. Lidocaine as well as a lot of bacteriostatic saline. Something called bicarb, so there's less sting with it. Works out really well there. Yeah, there's a lot of different ways. How have you been doing, by the way, Masood? Hopefully you've been feeling well in life, and I think that it's always a pleasure to have people coming all the way from the East Coast. Hopefully it hasn't been too freezing for you. Nacho, how's it been going with you too, by the way? Hopefully you've been doing really well. Sorry, just coming in. What are the procedures done in the pictures above? This was a few steps actually for this patient. She had very thick scars. It took a long time. Actually, I worked on her about 7 years ago. I still see her sometimes. She comes in for a bit of Botox, things like that. Her skin looks amazing. It looks incredible right now. Really impressive improvement, really what we had to do for her. We had to do subcision. We did TCA cross. We did ablative CO2 laser. I did it actually about 4 times for her. So three of the heavier sessions, another session of just kind of a little bit less intense, and then a lot of volumization. It is a great improvement. What's impressive about her is that she's held on to her improvement. A lot of people ask, how long do results last? How long does it last? She's a very great example of this. She's somebody who really, for years, I've had her now where I haven't really done much at all really at this point, other than, again, some Botox. I don't really think that I have to do much more with a volume here. It's just she's been happy and excited with the rest of her life. And like I said, I just see her a few times. She does a bit of pico lasers though for pigmentation, and that's, I think, probably about it. She doesn't do too much more though, so it's not bad actually, right? After all that scarring, which was as significant as it was, it's really not that bad anymore. That's pretty cool, right? That's a pretty cool thing where she had very, very severe deep scars, and now we're at this point here. Did she get Sculptra? Yes, we did Sculptra as well as Radiesse for her. I had to do actually, and then also Belafil. I did a lot of volumization. It had to be done because she had so much fat destruction over here. She's somebody who's also really fit, doesn't have much fat also, so there was not really much of an option to do fat transfer in her case. I wasn't going to be able to have great fat for her. So doing things with volume with Radiesse, Sculptra worked out incredibly well. But Sue's saying his skin has been doing much better and better over time. I was actually thinking to come back for some more Belafil soon. That's awesome, Masood. Thank you so much. Masood's somebody who's been doing Belafil. It's been working really well. Lately, actually, interestingly enough, I will say that interestingly enough, I've been seeing a lot more patients ask more questions about volume. They're saying that they're hearing stories, not necessarily about not really from me, or our patients, but they're just hearing that like, oh, something has been occurring with patients that do volume. And do something like, for collagen, potentially like Belafil or Radiesse or Sculptra. And I think it's worth kind of going through those questions and double checking. So how about you guys? What things have you heard or what concerns do you have about volume? And then maybe I could try to help answer those things while we're on right now, and then to see if we could chip away at some of those questions and maybe make sure that it's a little bit easier for you guys. Because I know it's daunting. I know there's a lot of information out there. I know there's some practitioners who just say, don't do this, don't do that. And, I think it's so it's worth like figuring out what's the actual concerns that people have. I think that, from my standpoint, I'm okay with almost any of these products for volumization. I don't get any benefit from whatsoever from any of the companies. I'm happy with what I use. I'm excited about anything else that potentially comes out. But it's not like it's like, not necessary for me to use one product. But so if somebody's like concerned, sometimes patients say that like they're worried about this product, and I okay, if you write about it, I'm not gonna really argue about it. It just will be like, why don't we just go do something else? I know from my own standpoint, it's been very safe. I've had no problems with my patients, my own face, my family members who've done it. Patients, of course, like this patient, for example, so many patients who've had no problems whatsoever. And Masood is on here. He's done Belafil as well. There's other patients on here as well. And, there's a lot of patients who will just have like absolutely no problem. But then there's other people who are like so worried, and there's already anxiety with acne scars. And the last thing I want to do is like have people have like excess anxiety, because then it's just not great for anybody. So if you have it, like let me know. We could take a look and see. Okay, so let's see. Mama 5. Oh, that's interesting. I have actually 4 sisters too. So my mom was of Mama 5. I had an occlusion from filler used from scarring. Now I've had a CO2 laser in ultra clear. Sorry you had an occlusion. That's typically hyaluronic acid based products. Occlusions are typically hyaluronic acid. Extremely rare. I'm not even sure of any incidents that I'm aware of recently of things that are biostimulatory products like dilute Radiesse or Belafil or Sculptra really causing occlusion. I haven't really heard of those, but hyaluronic acid would definitely be a possibility where it could potentially cause an occlusion. There's just different ways of preventing that. Hopefully now you've been on the road of recovery right there, where you had an occlusion. Occlusion basically means that it's possible, let's say, especially like a gel product like Juvederm, for example, sometimes could go into a blood vessel, and if it goes into a blood vessel and it's not dissolved on time, or something else potentially occurs with it, there's all sorts of issues that could potentially occur where the blood vessel no longer has that blood flow and it's blocked. Now you could actually get skin necrosis. The skin around it dies. And that is, very distressing for a lot of patients. Of course, it's a very, very, very stressful situation. I had a plastic surgeon reach out to me really about a year ago, I would say, and it was saying that he had an occlusion. He knows that I had an ultrasound, so essentially I went in there directly and dissolved the pocket of filler for him, and it worked out really well. Complete resolution of that occlusion. Actually, it's really, really amazing because it looks at one point like it could be catastrophic, but you go in there directly at there with that spot, where the occlusion is, when you visualize it with the ultrasound, and you could dissolve that. It looks really, really good then afterwards, and complete recovery for that patient actually. And it was touch or go for a while. He did like 20 vials to dissolve. Yusuf is saying, hi, Dr. Qazi, can you talk about your diet? I know you mentioned avoiding dairy because of IGF-1. Anything else? Hi, Yusuf, by the way, good to see you on. I also avoid carbs at nighttime. That's one of the biggest things I think that for myself helped me out for just general lifestyle. I think that it helped me just maintain my weight, and I still fit in clothes that I wore like 25 years ago. So, I'm 43 now, and like I knew that like in my 20s after college, especially, that my body was changing and it just wasn't going to be able to handle just like the way I was eating in college. And so I just adjusted my regimen completely, and it worked out very, very well. So I was able to just keep the same weight. And, actually this week and last week too, I had a lot of patients who I was seeing for second or third rounds of treatments. And I was asking them like things like, because some of them had just had such incredible improvement. And I was saying, what are the things that you're noticing that you're doing potentially like for diet-wise or exercise? Did you generally say that they eat pretty clean, eat healthy? They try not to eat like processed food, things like that. But the other big thing, actually, interestingly enough, the other big thing for the last couple of weeks has been patients are reporting that they're working out a lot more. They're working out like 4 to 5 times a week. And that's something actually I noticed also for the patients that I've said that some of the best results is that they tend to be people who are just really fit in general. And they're just working out quite a bit, and they're just otherwise more optimized, where they're on like a healthy track right now. And I would say that's not really talked too much about for collagen production. Just the fact that like exercise and just like kind of just overall just general health is really talked about. But exercise seems to be something else that really does make it so that potentially it probably helps with what I always talk about, which is microangiogenesis. So those microvascular circular, all the little blood vessels, especially after a scar, you really want that circulation to come back. So it probably is really helpful for that purpose. On top of it, there's other factors that are going to help out with it, but something that it needs to be investigated a little bit further. So, if you're one of my patients and you have great results, sometimes I'd also ask you, like, especially if it's like after 3-6 months, I'm like looking at this is excellent improvement already. Let's figure out what's the thing that is making it better, because it's very, very helpful for a lot of patients if we could do that. I saw you last week. When should I come back? I did TCA, Bellafill, and laser. Orteja is saying that. Thank you so much for coming on. Typically, I wait about 3 months after laser. But if you're nearby, like more TCA is going to help you out. So usually I wait about a month after we do the session, and we'll take a look and see, about doing potentially some Bellafill at that point. But usually I wait even further out for Bellafill there. But at least TCA, especially if you're nearby. Let's see here. Sue is saying light scarring, like pitted crater scar. What to do? Tried microneedling, but it didn't make a difference. The last couple of weeks, again, a lot of patients were reporting that they were trying microneedling. A lot of people tried microneedling, and it hasn't improved their scars. A lot of people say that it did not improve their scars, especially boxcar scars. Very tough to improve with microneedling. But these kind of scars, where it's rolling scars or it's this thickness around the edges, really not going to improve much. Even if you do like 100 microneedling sessions, it's really not going to improve much. Does salmon DNA help? It helps with maybe like overall skin glow, potentially, possibly. But scars, a lot of patients will say that didn't help much at all for their scars, which is why I personally haven't been doing it. I am really wary of it. It's something that's not even just, it's not off-label, it's just not approved at all. Really, to me, would be very risky because you can run into problems, and I don't run into problems like this. It's just like really something I want to just be able to sleep well at nighttime without stress, without worry. And I feel like as if I'm doing something that's not even tested or studied properly over here, I'd be very worried about it. And patients are reporting that there hasn't been much improvement. So then it's like, I don't know. Is it really worth it for anybody to do it? Dan Aesthetics, how much improvement should we expect with TCA with ice pick scars? Is it worth it for larger open scars? If not, do you just go straight to CO2 or erbium YAG and subcision? You could do TCA for almost any kind of atrophic scars. Almost any atrophic scars, you could do it. It's just a matter of how you do it and where you place the TCA. There's actually, I'm placing it right there in the video right now. Interestingly enough, you can see that I'm going directly, right now I'm doing a pinpoint erbium, but I'm going directly inside the base of the scar. And sometimes you may see that I go in the inside walls of the scar, and I could get it so that I do that so I could get the scar to contract a bit there. Works out very, very well for the right kind of scars, even rolling scars. In this patient, I did it for her rolling scars also. TCA could be a great option. I don't usually use the laser by itself. I like to do TCA with laser, with subcision. All things that work out very, very well for patients when they have deeper scars especially. Do you accept Blue Shield insurance? I don't take insurance because insurance doesn't cover these things. It really doesn't cover any of these treatments. I think part of it is because insurance companies just don't want to cover things, of course. But also, there's not really like a standardized way to do these for other practitioners. So, like, how do they judge that like what people are doing is the right way? And I'm not one to defend insurance companies at all, but I think that's probably also a factor into this. That it's tough for them to really say like what's the real way to do things because there's so many different variables for patients, each individual patient, and then between different practices, things like that. And there's people that just swear by different things. And you have all these guys who are bought by these laser companies and they push the things, and it's just like the whole field is just completely muddled right now. So it's very tough to really go and like really go really precisely at this and say, hey, this is the thing that's going to work for insurance purposes. I just saw a video of you not recommending sculpture for lower face after subcision. What's best? Well, what I was saying is that I wouldn't do it at the same time as I do subcision. I almost never do it at the same time as I do subcision. It's really risky at that point because you could end up actually having it where it gets really heavy for yourself over time, and it's just not in the right place then. It's just really gonna spread out way too much, and I wouldn't recommend it. In general though, you try not to do too much sculpture in areas where it's mobile, where you're moving, like you're smiling, talking, things like that. You try not to do too much with that over there. What can you do after flushing, after laser and TCA session? Well, it actually may not be flushing for too long. Typically, that's something that's like tends to be just for a couple months. But it's possible that you have an underlying form of rosacea, just a reactive form of it right now. And what we may want to do for that is actually just do a short burst of like doxycycline. Actually, interestingly enough, works out really well. It's anti-inflammatory. It works out for rosacea and post-inflammatory erythema like that sometimes. And then just keeping it really clean, really gentle with what you're using. So I talk about like Baby CeraVe works very, very well. Actually, it's a great product actually, Baby CeraVe. Do that with like a gentle cleanser or preferably just water, and then a physical sunblock. And like start with that. It usually calms it down really well. If you need to, there's other ways of just calming it down with potentially lasers, but mostly, almost always, I should say, just using moisturizer works very, very well. Do you do training for TCA or phenol peels? Not this year. Last year I did a few, but like this year, really, really jam-packed. So I'm gonna try maybe next year. So we'll see when I could do it. But it's just like, there's just so many patients I really want to just make sure I could circle back with and work with. So it's very, very tough to do training. It slows me down a bit there, and I just want to make sure that during my day, and plus I do these, so I got to make sure that everything's covered for people. But I'm happy to help out. There's actually doctors sometimes that reach out to me. I do try to help out with things, but at the same time, it's like I got to make sure that this is done very, very safely. So especially with like TCA phenol, it should be done a certain way, and we have to just be really, really careful as we do it. Let's see, Zena is saying, I had a lower facelift and buccal fat removal with indents bilaterally on the chin. Surgeon says it's submandibular gland and to get Botox to flatten out. Can you help me? Advice, please? That's a short-term fix for that. It's likely not a bad idea. It will help actually, but it's a short-term fix. You actually likely need to see an ENT surgeon to get that removed. But that's a bigger procedure though. So you have to see if it's really bothering you. What exactly is happening right there. But that could happen actually after doing liposuction in the neck, and it reveals the fact that there's these submandibular glands that need to be removed. What is the average price for subcision and TCA cross and CO2 laser together? I think that's what I need. That's offhand, it's our prices are online, but it's usually most patients spend about $5,000 to $7,000 on their scars. Yes, our prices are online actually. So we have it online. We have all of our prices on there. The only thing that wasn't on there was just the subcision price, but that ranges typically about 800, 1200 for the vast majority of patients, but usually not much more than that. The Fab Monkeys is saying, on brown skin scars, I did radio frequency microneedling with subcision, PRP, CO2, 2 sessions, TCA cross, saw little difference. What should I do? I have surface scars now. I'm not a fan of radio frequency microneedling for scars. I think it's actually could be problematic for patients. I really think it's better to go directly inside the base of the scar with something like TCA, break up the scar tissue if you need to with subcision. You did some subcision before, but if they did PRP, it's really possible that it may not be the full effect. Likely what we need to do is break up that scar tissue really effectively, and then plus or minus a little bit of laser. Slayer, you said $5,000 to $7,000 for each session. That's typically the first session, and then future sessions are for the laser part and the TCA part 55% off. So if you do the bigger combination session, future sessions are 55% off. So sometimes it's just like a couple $1,000s more or so for future sessions. And like patients that require multiple sessions, it's really helpful. The only thing is that some people just need a lot more volume, and that's just the thing that sometimes lags a bit there. How many sessions do you suggest for a female patient with pick scars from, or let's see, I think you're saying ice pick scars from out of state for TCA cross? There's ways of speeding it up, like maybe we do excisions would speed it up. Sometimes lasers speed it up as well. It may help a lot actually. And sometimes I sand it down, and the thicker part of that scar tissue I sand down. But let's see exactly what's going on. You may not need to do as many sessions, because if it was just TCA cross, it requires a lot of sessions there. That's the one aspect there. Biggest baddie, look forward to seeing you. We'll just go through on our page, drqazi.com. Just schedule a consultation directly on there. No, I'm not Persian actually. Thank you. Hopefully, I don't know what's going to happen with Iran. I don't know. A lot of people from Iran, a lot of people are looking forward to a war there. I'm not sure why. I don't know. A lot of people over here that I know, patients, they're like excited about the prospect, and I'm kind of shocked by that whole thing, to be honest with you. I'm really shocked that they're. Are you interested in that? Like, are you looking at that? Because it's kind of wild. I've had some patients that tell me that they're actually looking forward to the U.S. It's shocking. It's shocking to me. What is the redness is only in areas like TCA and laser. Will vascular laser help? It's possible. It's possible it helps with that. Where if the redness is only in TCA and laser, but that could be new skin that's forming too. It could be that. It could be that it's new skin that's forming over there. If it's more like it's just like residual red vessels, and you should see your doctor, see is it like these little residual vessels there. We may have to do a laser there to help with that there. What are your thoughts on Skin Vive and Soft Wave? Skin Vive is going to be really mild. I don't know anybody that's too happy with that for scar purposes. I actually don't know anybody. Skin Vive, I'm not sure. Is there anybody that's happy with it? Soft Wave, it's okay. It's okay. It's really mild. I don't know too many people that are going to be too happy with Soft Wave for scars, to be honest with you. And there's a lot of patients who I've done like 10 sessions, not me, but they've done 10 sessions or so, and they haven't seen any improvement. Ice pick and bioscar scars for African American skin tone, similar skin tone to Michael Jordan. Yeah, that's, I have actually a lot of patients who are of African descent. A lot of times you don't necessarily have to do like stronger lasers. You can just do like low heat, low energy. Like the erbium laser, potentially, you could do something where you lift up the scar tissue with some Bellafill. Those work out very well for that. TCA cross, so a lot of things that we could do actually. I'm on Accutane. Are you jealous? No, that's awesome. That's great. I love it. I don't know if did I put you on that or not. A lot of patients are confused sometimes because they think that I can't do scar treatments while on there. While on Accutane, but I can. We could do it on isotretinoin. We could do it, especially with low energy devices for vast majority of things. But even if it's like severe scars and you're on like microdosing or low dose Accutane, it's possible we could do it there. So don't feel like just because you're on Accutane we can't do treatments. We definitely should be able to. It's very possible. Let's see. G is saying, hi doctor, knowing enlarged pores can be considered scars, what is the best treatment? TCA, probably one of the best options. TCA is one of the better options there. Is it okay to fly after your treatment or is it better to drive? It depends, it's up to you. Just have somebody drive you, I think. That's the best way to do it, honestly, because you're going to be exhausted. You should just rest and relax. I am very humbled and privileged. Like I have a lot of patients who come from very, very far away. Sometimes they drive 10 hours. I'm like just shocked sometimes. I hear that some people come on drive for 10 hours away to come over. And I take it very seriously. That's why I want to make sure this is done very, very well. There's a way to do this. So however you choose to do it, I'm going to make sure it's done exceptionally well for you. I'll tell you that. It's just like we got to make sure that this is done very, very well. Good to see you too, Marshmallow. Hopefully I'll see you really soon. When do you think you're going to be able to come by at some point? I see there's a virtual consult option. Can I do that because I don't live in LA? Yeah, most people do virtual. Most patients come from out of state, so that's the case. Many pro-monarchist Iranians, to be honest, it's kind of similar to how Miami Cubans are pro-blockade. So we're talking about how a lot of, not actually Iranians in Iran, but Iranians over here, there's so many who are excited about the prospect of America bombing Iran. Like honestly, there's so many. And it's shocking. They've been silent for 2.5 years, like for genocide, all sorts of things, but they're excited about the idea that like the US, which is like run by these guys that we just saw in the files, is gonna like save and liberate their country. It's just like shocking to me. And I don't know what to say about that, because at some point you got to look at things and say that like, is there something that like we should put 2 and 2 together here? And like, where has it been like that this has been a successful outcome, And it's like, I don't know, just next door to their country, Iraq was completely ravaged and destroyed. But like, honestly, I was talking to patients that tell me, they're blacking out my screen back there. That's interesting. But yeah, so, it's kind of interesting though, that to me that like, that people are looking and excited. They're talking about nuking their country, their own country. And they're like, okay with that. Like what? What? Hello? Yeah, I don't know. I don't know what's going on there. Like a lot of the people that are for that, it's just like, it doesn't make sense. I can understand you hating your regime and all that, but like to be like now jumping up and down for mass murdering like the people from your country, it doesn't really make much sense. But hopefully there's more people that are kind of have more common sense and they're going to talk about that and talk against that, I think. What's the best for scars? Chemical peel, CO2, or PDRN? Well, it depends. If it's a deeper chemical peel, something like potentially like a phenol peel, that could help out. Even TCA cross could help out as well. Or a TCA peel could help out for certain kinds of scars. But it's, really risky. Not many people do TCA peels. I mean, you have to go with someone who's very experienced for that. And for phenol peels, we do them, but just like there's not many people who do them. Laser works even in patients, in providers' hands who are not super skilled with it. Like they can get pretty okay results still on it. For a lot of scars. So of those, I think laser is one of the best. PDRN is not even in the equation. Had they forgotten what happened to Iraq and Libya? I think that most people in this country, unfortunately, have amnesia. It's called the Mandela effect. You could take a look and see. It's called Mandela effect. It's just about really over and over. They just like almost like to do this mind wipe, where they're just like there's so many things that happen every like day now, every week, and you just forget what happened the week before. And then just sort of just like rewrite the history of like what happened. And it's like nobody to this day even knows what happened with the Iraq War. Like it's like in my time it was like the biggest thing. And now like this generation, like I talked to some people, they don't even know what happened. They don't even know all the lies that occurred, everything like that. And I was like, it's like shocking to me how people just don't know what they did. I used to go to those protests and all sorts of stuff, and it was a huge thing. It was a massive, massive protest against the Iraq War. And I remember it was just like there was such a huge push for it, such a huge push. And all they were saying was like you hate America and blah, blah, blah for doing all this. And now, we found out that it was all a lie, every aspect of it. The weapons of mass destruction were a lie, everything about it. You see in these files that these guys were responsible, it's clear as day that they were responsible for 9/11. These guys were responsible for 9/11. That's how insane this whole thing is now. And so my generation, which grew up on all these lies, it's like, I think finally we're looking at this and like, hopefully now we're seeing that this is like, there's actually people that are reaching out to me now, like people that I knew from a long time ago that are reaching out because I've been talking about this for so long. They're like, you were right about this whole thing. It turns out that this whole stuff was right. Like all these things that I've been talking about, it turns out was all true. These guys completely manipulated the whole world, and like they committed 9/11, which is like the major thing, excuse and reason why we did all these things. They pushed us to go into Iraq. They gave us the fake information to do that they were WMDs, and now these same people are pushing us for war after war after war, and now against Iran now too. And I think that it's like at some point we gotta look and see, how do we take care of people over here, local people. A lot of people are hurting right here. And like it's time just to refocus on this stuff and really push back against this. And unless we actually have reasonable, like open discussions, like people are saying, you know, about this right now, like I think that we are not going to be able to evolve, and these guys are going to continuously cause problems for us. They're going to continuously chip away at us and divide us constantly. And it's very easy to do. You can see that over and over. But fortunately, you know, I was shocked actually. The last couple of weeks, I was saying that a few weeks ago, the last few weeks now, I've been noticing more and more patients are telling me that they didn't even know about this stuff. They didn't know about the Rothschilds. They didn't know all this stuff. And they're shocked what they were discovered. They're just stunned by what's going on in this world. And it's like, finally, we have this where it's more open. And it's like, I think it's about time we could have this thing, you know, it's about time that we could say, this is like where we are, and this is who's running the show, and let's start paying attention to this and start seeing how do we organize and get better and smarter at this. And until we do that, until we actually get that, until people are actually like are willing and confident and comfortable enough doing that, we're going to continuously get beaten down. And like the problem is that for me is that I just actually don't give up with anything. I'm working on scars and just keep on chipping away at it, keep on chipping away with every single thing that I do. And I'm just not going to give up on the fact that we are ruled by a bunch of evil psychopaths, and it's time to actually just like organize and figure out how to solve this problem here. And really, it's a solvable problem, but it is something that like I don't think that anybody really should just be sitting and taking lightly. Just look at this and say, hey, this is a problem. Let's accept it, and let's work together to figure out a solution here. And actually, believe it or not, I've had patients all over the country. You may not see these things because your algorithms are all screwed up now. They took over all your algorithms. They took over your news agencies, everything. So you don't see necessarily all these things that I'm hearing, but from different pockets across the country, different groups, different ethnicities across the board, military people. I'm talking about people that have been professional in the military for so long, and they're saying things that you never would have believed just a few weeks ago. They're saying things that like really clear where this is going now. And I know where this is going now. And it's actually for the first time, I could see that there's a certain trend now that we could see now. And it's actually could be very, very positive if more and more people are talking about this and more people start investigating this. It could be a very, very good thing because you guys could see that there's a lot more people behind the scenes now that are looking at this and are awake about this. And I'm telling you that there are people that really do want to make a big difference, and they're capable of making that difference. They just are, you know, unclear about like they can't talk to each other. I'm like, you know, sometimes I tell people like you should talk to the other person because one person in one military department is saying another thing, and like, you know, they don't know that there's so many people that are aligned with their exact viewpoint, and they are aware of who's running the show, and they're against it. They no longer want to be occupied by this. They no longer want this. They don't want this anymore. So take that for what that is and understand what I'm saying with that. That's a very important thing, actually, what I'm referring to right now. That's the moment we're in right now, where we're across the board, across all segments of society, we have a uniform opinion of who our enemy is. That's actually a huge deal. That's a huge, huge thing. And that's never happened before in human history for our country, I would tell you. That's never happened. That's never happened, really, where we know that. And it's no longer a thing where people are looking at each other and saying, well, you know, this person is this ethnicity, this ethnicity. There's a lot of people now who just recognize that, wait a second, we're all in this together. All of us are in this together. And there should be a clear divide about the people who are still aligned with these elites and who are aligned with these elites and who aren't. And I think it's pretty clear. It's just like, you should see it. Everything that comes out of the State Department's mouth is just a lie. Every single thing. Everything that comes out of it is a lie. So just as soon as you see it, it's just a lie. And you go from there. And just that's a really good starting point. As soon as it comes from the State Department, it's a lie. And then work your way out of that. And then it's like, okay, that's pretty cool. So unless you see with your own eyes, like, don't trust it, really. You know, and like, unless you just like, and even if you do see it, they're going to start, and you see it, what they do is they put it in the comments, this is AI, this is AI, this is AI. And it's just all a bunch of, they just try to confuse people over and over and over again. Or they're like, look over there, there's a UFO over there, there's a bunch of stuff over there. And it's like, don't pay attention to over here, there's aliens that are invading us. And it's just all this stuff, it's just like, we see this over and over again. Are you Muslim? No, I'm not actually. I just believe in human rights. I'm a humanitarian, that's what I believe. I'm a humanist, they should say. I believe in the fact that we just have to protect human beings. And actually really all living creatures, to be honest with you. But I really do believe that this world is only going to change if we actually view each other as more equal. And we recognize that the elites don't view us that way. And that's actually a very good recognition. And so we just carve them out of our existence. Let's see, are you Farsi speaker? No, I'm not Persian, I don't speak Farsi. Is yellow pigmentation around the eye a good sign of well-done subcision? I'm not sure exactly what that would mean. Are you referring to like a bruise afterwards, that there's yellow around the eyes with a bruise? That doesn't necessarily have to happen. That doesn't necessarily mean much at all really for that. Really what we just want to do is with subcision, put a lot of numbing solution in there, put a lot of epinephrine in there to actually prevent bruising. But you definitely could. Yeah, you definitely could have it. It's just not really, it's not correlated one way or another when it happens with that. What forehead scars? Forehead scars, I have a lot of forehead scar patients that I do all the time, every single day, probably once or twice a day at least. I do forehead scars. It works very, very well where I break up that scar tissue, do TCA cross, sometimes do some laser as well. And volume, because it's really easy, really fast and easy to get that area destroyed really quickly with scarring. So you no longer have really as much fat right there. First of all, you don't have fat much to give there in the first place. Then a little bit of acne, a little bit of scarring can quickly destroy that fat. So that's my thing. I quit smoking so that I can prioritize my health. You told me it was important. I did. Thank you so much. Awesome. That's my big thing this year is to chip away at the smoking industry. So that's really exciting to hear. I really, really want to chip away at it, actually. It's a very, very big goal for me. And so I'm happy. I hear it over and over now that patients are getting rid of it. How did you get rid of it, by the way? What did you end up doing? Hi, you did my TCA subcision yesterday. When can I do red light therapy? I'm not a big fan, blonde bandana. I'm not a big fan of TCA and, I'm sorry, I mean, I'm a fan of TCA. I mean, I'm not a big fan of doing red light therapy, especially after doing TCA or laser, because you could get hyperpigmentation afterwards. And that's something, by the way, everybody should know. Anybody who's darker skin type, so Fitzpatrick 4 and above, for potentially you have more melanin, be really careful with red light. And then especially be very careful after you do a laser treatment, because you could get more pigmentation issues that way. So just be very, very mindful of that. That if you're doing red light, a little bit of heat, it could actually trigger melasma as well, post-inflammatory hyperpigmentation. Not a great idea. Not a great idea for that, actually. Just so you know. Where was that there? I missed where was that? Got it. How long to wait? I'm very pale. Well, that's good that you're pale, because it means that you're not going out in the sun. Typically you would wait about 6 weeks or so after you do a procedure before you use like any kind of energy like that, and that would include red light therapy. I know I missed a few questions, so I'm going to try to hit back on some of the ones that I missed. Hi, doctor. Let's see, Anna, are you still on there? I know I missed you a while ago, so hopefully you're still there. But Dr. Qazi, I have a virtual appointment with you on March 5th and had already made my appointment in May. Can't wait to see you. Good to see you too. I'll see you soon, Wib. Does RF microneedling help with mild acne scars? Maybe mild, if it's very, very mild. Maybe mild. I'm up and saying, what's up, Dr. Qazi? I see you're finally streaming on YouTube again. Great to see you. It's been a while. Thank you so much. Yeah, I think we finally figured out the bugs on it. So I'm really, really excited to be able to have you guys back. That community on there is really awesome. Thank you so much. Godard News is saying, hi, Dr. Qazi, can subcision change your face shape and potentially lose your full cheeks? Subcision, if done correctly, will actually help you age better. Because, for example, for this patient, she prematurely aged. She was robbed of the way she normally would have looked because of her severe cystic acne and then her scars. She actually had areas where it was pulled and stuck, and there's a lot of facial fat loss as well. So subcision actually allowed her to age the way she normally would have aged. But done incorrectly or done in patients where there's other issues potentially, yes, there's a possibility that you could get it where the lower face can pull down a bit. And I've seen it. I've not for my own patients, but I've seen it in other practitioners. I've seen it for sure. Where it tends to be though is that they did it combined with something like Sculptra potentially in the lower part of the face, and maybe with the talar liberator as well. And I think that combination could be very problematic for some patients, especially in the lower part of the face. So I don't do it that way. I think there is a way to do it very, very safely. Do you recommend Sculptra for volume? I do recommend it for the right patient, especially if there's a lot of fat loss. It can work very, very well. It can work incredibly well for that. So yes, I do recommend it for that. Where is it? Okay, Webb is saying, do you know anything about Alloderm? Just did it with subcision. Apparently it's space holder that prevents scars to retether. Not a filler, actually. See you in May, hoping to do subcision Bellafull. Alloderm, is hit or miss in my mind. My issue with it is that I don't know if there's going to be a reaction down the line with it. That's my thing. And I just don't want it to run into that problem where there could be potentially a reaction on the face, which could end up causing a nodule or some sort of immune reaction. And I'm not sure if that could happen with something like that. Alloderm basically triggers your own body, but it's made from cadaver tissue. And I get worried about things like that. I get worried that potentially it's exogenous, something else that's going onto your body, injecting, and maybe it could end up having where your body reacts poorly with that. If that occurs, you may not have a really easy way to just resolve that. You may not have a really easy way to just improve that complication. So that's my one big thing with Alloderm. Bellafull is like the only FDA-approved product for scars. There's other things, of course, you could do. But I do, I do want to push back a bit on this concept that somebody said that it's going to prevent scar retethering. That's a pretty bold claim that somebody made, that Alloderm is going to prevent scar retethering. I'm not even entirely sure what that necessarily means. I think if they want to prove that, they should prove that maybe with MRI studies or with like ultrasound and really showcase and prove that that's the case, that like you do Alloderm with subcision, it's going to prevent scar retethering. I will say, to be honest with you, a vast majority of patients that I do, and they potentially are, and many people are scar revisions, meaning that they've had treatments elsewhere, and now I'm fixing that treatment, and to make sure that we can get optimal results. Those patients a lot of times have said that they've done subcision elsewhere, and even people that say that they specialize in scars, and there's so much scar tissue when I go in there. There's so much scar tissue. And there's a couple people that, like, if you go in there, it's very, very smooth and extremely smooth, even years later. And myself included, like, I will put myself in that category. Like, if I go back in there, if I have to do something potentially with like filler or something like that, I will see that it's very smooth after I had done subcision. And that's a pretty cool feeling, and it goes to showcase to me that there's the concept that it has to retether isn't true. I don't believe that it has to retether. I really don't. I think that in certain areas, maybe like the forehead, if you have a lot of movement, maybe, but right by the nasolabial fold, I could say possibly. But in the cheek area, it's really unlikely, especially if you do it very, very properly. And even when it does retether a bit in some spots, it's a pretty mild retethering if it is anything. And was it really retethering, or was it just that you didn't break it up effectively enough? Because like the location, but maybe the forehead, you couldn't use certain tools, like particularly like sharper blades, and maybe it didn't break up as effectively. Likely that's the case, to be honest with you. Likely that's the case, that you probably didn't push it as far because it makes sense. You want to keep it safe, but it's not retethering. So when somebody says that, well, I'm going to do filler to prevent retethering, or I'm going to do, in this case, Alloderm, which is actually the first time I've heard someone make the claim that Alloderm is going to prevent retethering. I don't know what that would, where they got that information from. But if they're making that kind of claim, extraordinary claims require extraordinary evidence, and that's how I view things. Like if you're saying something like that, if you're saying, a bold claim like, Alloderm is going to prevent retethering, then first prove that retethering occurs, which hasn't been proven, and second, prove that Alloderm is going to be a way to prevent retethering. Those are pretty big, bold statements to make. And as a physician, if I'm sure assuming you went to a physician, there's sort of an obligation there is an obligation really to fit within these guidelines and what we could say. And there's things that you just shouldn't be saying and making these claims. I mean, certainly if you say like, here's what I saw because I have evidence and like objective evidence. I'm not saying like you need a bunch of studies. I'm saying just like you have an ultrasound, you see it on the ultrasound, here's a scar, it's a high frequency ultrasound that showcases it. And then here's where it is, where it retethered. Great, you prove that. Now, here's where I did it, and it didn't retether because I did alloderm. That's a really cool thing. That's awesome. Just showcase that to people. But otherwise, it's very tough to like make that claim like that. I think it's a very, very tough claim. Shallow rolling scars. I'm on Accutane. All the inflammation went down from acne. I missed the question. What was the question though about that actually? I think I skipped over there. Miriam saying, hey, Dr. Qazi, my skin has healed with no pigmentation, but got some redness in the area sometimes. Good to see you, Miriam. Just do, I know you're on tretinoin as well right there. Just a lot more moisturizer, honestly. But hopefully you've been doing really, really well in life. What are your thoughts on CureJet? I was open to it because people were asking about it on here. They were asking a lot of things. A lot of patients were saying, is it okay to do CureJet? And what do you think about CureJet? And I had bad experience before with another thing that was like this. It was like these jet peel type of things that like push in this liquid into your skin. And they made all sorts of claims, these guys, and it turns out that these are like these companies were making these claims, and I was like finding out that it wasn't really, there was any evidence or proof that I was actually doing these things that they were saying. And CureJet I was a little bit more open to because people were saying, they were trying it for substitution, this and that. But I heard patients that tried it, didn't really help out for their scars. I seen like what they were doing with it. It doesn't really seem like it's particularly going to be too effective, and the way I'm seeing it there. But sure, I could take a look at it someday, maybe one day, if it's something that showcases that it's really great, awesome. So far, it's really murky to me. I think that, again, an extraordinary claim that requires extraordinary evidence, which is CureJet. And especially because we know that like there's these other jet things that they're saying. So basically, for those who don't know, it's like what they're claiming for some of these other products too, is that they're pushing water into the skin. They're pushing it into like some sort of, sealing into the skin without any needles. I thought it was amazing when it came out. It was like this Israeli company at the time that like was pushing at this thing, and I was like, oh, okay. It turned out they actually got it from like some, or at least that's what I'm hearing, is that they got it from some company from South Korea, and then just sort of like, I guess just took the patent or did something with it, but did something with it there, and. Yeah, I'm not sure, but like either way, they essentially were pushing this thing and marketing that way, and pushing this thing like where they say that there's like this sealing that goes in without any needles. That sounds cool. Like, oh, that'd be awesome for like PRP, for example. That would be really great if you get platelet-rich plasma and you don't have to use needles and just push it into the scalp, for example, for hair, things like that. Problem is, it wasn't working. Problem is, it didn't work. And then I see it like there's another company that's out there, other companies that are out there, and usually they're coming from Israel. And like I see all these doctors who are all the time like these key opinion leaders, and they're paid for by these laser companies. And they're telling these other doctors that it works, and they're doing it for like company after company. That like just one company will shut down, another new company will come like 2-3 years later, and then they'll do the same thing for that company. It's a crazy business, this world. I'll tell you that. The aesthetic world is like, you go in medicine and you think that like, oh, it's going to be like really clean and stuff like that. Hospital world is like terrible, but the aesthetic world, like the way that it is with the market, with the way that these laser device companies work, the way that a lot of doctors work, it is really, really suspect. And it's like, it continuously occurs over and over. And nothing's changed, and there's no incentive to change. There's zero incentive for them to change. They're just going to get their checks, their thousands of dollars to make their speech, whatever else. And why would they stop doing that? If they're lying through their teeth about the product or whatever else, there's zero incentive for them to stop. So when you hear these things, and like you see that like certain people are pushing it, and you'll see it. Like you'll see now that I talked to you about that, you'll see that there's certain devices that were pushed a couple years ago, and now nobody's pushing it again. Nobody's pushing it. There's certain big radio frequency microwave devices which are associated with huge celebrities, and those celebrities pushed it really like aggressively. And then it just like disappeared. The FDA put out a thing against radio frequency microwave, said that, with Morpheus 8, it caused fat loss, and then suddenly like it just disappeared. You don't hear about it anymore. And then the next thing comes in, and then they throw another thing. And it's like over and over you see that. And you look at it and think that these device companies are pushing these products and saying that it's the device that works. But it turns out that I almost never use their aggressive settings. And I find that their settings are very aggressive. And instead, if you go really precisely and focused, on the scar itself, the scar tissue that's raised, for example, and you smooth it down, really chip away at it and carefully chip away, carefully chip away, carefully chip away at it, you get a much, much better result. And that actually works out incredibly well. Over and over and over again, we see this, where we see these patients where if we just stay focused on the areas that need to be, and we don't do much with the healthy tissue, now we get a very, very beautiful result. And you don't actually use what they're, the studies that they're showing or anything else that they're talking about, because so much of it is just like a lie. And so many things that they talk about, so many things that these device companies say is just not true. But there's at least a way to do it with the device that they have, or the right kind of device, if you just really precise with it. And precision is what this all comes down to. Precision when it comes to subcision, precision when it comes to TC across, when it comes to the laser, when it comes to the volume replacement, all that requires just being very careful. Do you perform excision for specific super deep scars caused by nodular cystic acne? Treating depressed scar for a flat linear scar that can be handled by laser. Yeah, absolutely. It's absolutely something I do a lot with. I love doing that way. Absolutely. That's a great way of doing it for deeper scars, especially if it's in the right area. And you could tell if it's in the right area if you smile and you see if it's along the smile line. And you can see where it's sort of folding with someone's smile. So if you want, I can't pull it up right now. I'm about to get off right now, but you can see, look up Langer's lines. If anyone, I saw some med students on here. I don't know if Yusuf, you're on here right now, you're about to go to med school, but there's a few people that are on here. If you want, you could take a look and see that there's a way of doing it. Langer's lines, you could take a look and see that that's what I usually use to determine if I should excise a scar. So that could be a little bit of a fun homework project for somebody who's going into medicine, or I see some doctors on here too. Oh, I'll answer this, doctor. Dr. Murphy is saying, have you used a thulium laser for scars as well? Yeah, I never really find that it's been too helpful. 9027 wavelength helps a bit with just some of the superficial pigmentation, a little bit with texture, like very mildly with texture, but it doesn't really help much with scars. And I tried it many, many times. I went really actually aggressive settings sometimes. My own self actually did not help much at all. I didn't really find it was very helpful. I know that they push it a lot. I know they say it's great for all skin types. I don't really recommend that though. Hi, this is the last question I'll answer here for tonight. Hi, doctor, do you perform combo procedures if the patient is on microdose Accutane? Yes, I could, yes. Yes, we could. So just talk to us. If you're on Accutane, it's actually sometimes a better thing, because a lot of times your scars can be better controlled because your acne is better controlled. They used to say your collagen response is going to be more predictable, which is awesome. Thank you guys so much. I'll see you again next Tuesday. Thank you. Take care.